I'll be talking today about my group's work on the NASA Health and Air Quality Applied Sciences team. NASA HACAST, as we call it, was formed in 2016 through an initiative of the NASA Applied Sciences program. I've been serving over this time as the leader of the team and also one of the 13 investigators. In this video, I'll talk briefly about our work leading the team and some of our research accomplishments. We have advanced three main types of projects. Individual projects proposed by the investigators who were selected for the team. Tiger Team projects that emerged from collaborations over the course of the team. And finally, a variety of outreach and engagement activities that I led in my role as team lead. To lead the team, I worked closely with Dr. Dagan Miller and Paige Bazan at the University of Wisconsin-Madison. We built a website with a lot of resources, including publications and news items coming out of our team, all of the presentations coming from our meetings, and many other tools and resources to make it easy for new users to connect with Earth observations. Some of the work of the team has also been documented in a paper that I wrote with Dagan and Danielle Jacob, who led the predecessor team to HACAST called the NASA Air Quality Applied Sciences team. That documented a number of our successes and philosophy behind these two applied sciences teams, including how we have grown the audience to connect better with NASA data. And one way we've grown that audience has been through meetings held every 6 months all across the United States. And we've grown the in-person attendance as well as our online presence. It was cited in a 2019 paper in Environmental Health Perspectives as a successful example of communication between experts and decision makers. In addition to leading the team, I've been active in my own applied research, working closely with Dr. Monica Harkey and my co-investigators, Dr. Brad Pierce and Dr. Jonathan Patz. We've worked with a wide range of stakeholders, including the United States Environmental Protection Agency, the Wisconsin Department of Natural Resources, the International Institute for Applied Systems Analysis, and we've built connections with the American Lung Association and the Lancet Countdown. So the results I'm about to present are really a group effort with many of the people shown here. The value of satellite data for model evaluation is enormous, and it's especially pronounced in regions that don't have very many ground-based monitors. And one example of that is work that we did over India, where we used a number of NASA data products. Here I'm showing the results from the Ozone Monitoring Instrument, or OMI, for NO2, and compared that with our model simulation of NO2 over India, which was conducted in collaboration with the International Institute for Applied Systems Analysis in Austria. That work paved the way for a related health assessment. And although we often think of air pollution as an urban problem, in fact, across the area in northern India that we studied with this approach, we found that the health impacts, especially premature death, was much higher in rural environments across a wide range of health outcomes. We also used satellite data of NO2 from the OMI instrument to consider how economic development related to air pollution. And there's a classic model of economic growth called the environmental Kuznets curve, which suggests that low-income countries get more polluted as they develop, and high-income countries get less polluted as they develop. And so we looked to see if we could see this relationship with the satellite data. And indeed we do. We found that you can track over time the change in NO2 in the atmosphere and see that as cities get wealthier, they tend to get more polluted if they have low income per person, and they get cleaner in cities that have high income per person. One of the projects that I'm really excited about that came out of a HAYCAST Tiger team was a paper led by Minghui Dao that I contributed to with one of my graduate students, Grace Choi. And in that project, we wanted to examine how different methods of data fusion led to different estimates of near-surface PM 2.5, because I think as we work to expand the use of satellite data for health applications, one of the primary areas of interest is the potential to derive continuous estimates of near-surface fine particulate matter. We've also been active in using satellite data to consider formaldehyde. So a project we conducted in collaboration with the EPA was to take the EPA Community Multiscale Air Quality Model, shown here in the upper left panel, and compare it with satellite data for formaldehyde from the ozone monitoring instrument. And we found that no matter what the retrieval that you look at, it looks like the model is too low for formaldehyde. But looking at these different retrievals has also helped us understand and recommend the potential utilization of satellite data for formaldehyde model evaluation. In addition to comparing satellite formaldehyde with a model, we've also compared it with ground level formaldehyde monitors from across the United States. We had to average the ground-based monitors over these larger regions to have something appropriate for comparison with the satellite data because data were so limited in each area. We did find some clear patterns, and in the case of, here I'm showing data from the Midwest, that we find that we see the seasonal cycle clearly in the OMI formaldehyde data and that it compares quite well with temperature data. But even though we extracted this at the same sites as the ground-based monitors, the patterns are very different. And all three data sets show an upward trend. It's getting warmer. We see more formaldehyde in the Midwest with satellites, and we see more formaldehyde in the Midwest from ground-based instruments. But we certainly see that the satellite captures the seasonal temperature patterns more closely than the ground-based monitors. There are other interesting issues comparing monitors and satellite data, but this is just a taste of the kind of analysis we've been doing to better understand the utilization of formaldehyde for air quality management. Finally, we've been looking ahead to think about how the upcoming TEMPO instrument can be used for understanding urban air quality. We've built on past work showing how the difference in two polar orbiting satellites can help understand the diurnal change, the change from hour to hour happening in air quality. And what we found is that the surface monitors show a more pronounced difference from morning to afternoon as satellites. The satellites do see it, but it's less pronounced. And understanding how the hour-to-hour differences in what the satellite is seeing compares to what the surface is showing is really essential when we start to think about using satellite data for urban air quality analysis. And the final result from our team that I'll show is one that was looking at NO2 data from satellites and comparing with a wide range of metrics, including population, population density, and vehicle miles traveled for U.S. cities. And consistent with past work, we found that the satellite data agreed better with population than did the ground-based monitoring data. But we also showed that some cities really stood out for having unusual relationships between NO2 and population. And the standout cities were not always the same for ground monitors and satellites. So Denver, for example, shows higher monitored NO2 for its population level than you would expect. And that pattern does not show up for Denver in the satellite. On the other hand, Riverside, California shows a higher NO2 relative to its population when you look at the satellite data, and that does not show up in the monitors. So understanding how monitors and satellites compare with each other and with population and vehicle use on the ground is a first step to being able to ensure their appropriate application to public health and air quality management needs. So as we look to the future, we're really excited about the work that we've done over the past 4 years with HACAST and hope that this paves the way for effective and continued use of NASA Earth observations for public health and air quality analysis.